Coming up, the coronavirus stimulus package still up in the air this evening as congressional leaders disagree on terms. What the Senate majority and minority leaders both say still need to be worked out. And medical professionals are in need of PPEs. The FEMA director, though, exposing a possible issue amid this pandemic. Plus, find out why marijuana dispensaries in California will remain open during the state's safer at home order. Well, hello there and welcome in to BNC Prime Weekend Edition. It is a Sunday. It's March 22nd. I'm C.E. Huffman. Glad to see you. You know, as the number of coronavirus cases balloons to more than 300,000 worldwide, United States lawmakers are racing to pass an economic stimulus bill to aid American citizens. And today, the emergency legislation procedural vote was delayed. That after Senator Rand Paul announced he tested positive for the coronavirus. Melissa Rainey has a closer look at where negotiations stand. Now, a final vote to pass any agreement has been set for as soon as tomorrow. Meanwhile, masks are among the most critical items for healthcare workers fighting the coronavirus. Hospitals badly need the federal government's help on this issue. But it's not clear how many masks the government is actually sending. In fact, the FEMA administrator, that's Peter Gaynor, couldn't even give an approximate number when asked. Gaynor later playing down the importance of knowing specific numbers of masks shipped. Healthcare officials, though, warn the U.S. does not have enough gowns or gloves to meet the impending need of the healthcare system as the number of coronavirus cases grows. The Defense Department, though, says they're going to give 5 million masks to hospitals. While people around the world are receiving instructions on ways to avoid contracting and spreading the coronavirus, but what if you do get it? What can you expect? How should you protect yourself? Brian Todd has a look at the experiences of those who have been infected. All right, and for more information about local testing sites, symptoms, or the virus itself, we want you to go to the main source. That's the Centers for Disease Control and Prevention. Their website is cdc.gov. Again, that's cdc.gov. Well, marijuana dispensaries named essential in California, and they're going to remain open under the state's safer at home order. Nearly 40 million residents in California have been ordered to stay home to avoid spreading the coronavirus. Now, it's the first statewide mandate of its kind, with non-essential services like malls, hardware stores, gyms, movie theaters, and restaurants all closed. But among the list of businesses deemed essential, at least in parts of the state, cannabis dispensaries. Yeah, earlier this week, San Francisco's mayor compared dispensaries to pharmacies, saying cannabis has medical uses that people rely on. And speaking of California, it's among a handful of states urging non-essential workers to stay at home to help stop the spread of coronavirus and alleviate the stress on our healthcare system. Paul Verkemen is at a Lake Hollywood park getting a sense of what life is like for families since the order went into effect. Paul, thanks so much. You know, the governor's order means Californians should not leave home except for essential items like food, prescriptions, health care, and commuting to those jobs that we've considered crucial. New York, Illinois, California, all enacting stay-at-home orders. Another state joining the coronavirus fight. We've got those details after the break. So we all know borders all around the world closing as an effort to contain the spread of coronavirus, but the hunt for a vaccine is international, with hundreds of scientists collaborating right now to find an effective treatment. Now, there are currently no vaccines or treatments for the highly contagious COVID-19 respiratory illness, so patients can only receive supportive care for the time being. But in Denmark, the Danish National Hospital is heading European efforts to test an experimental antiviral drug. It's remdesivir, and it's to see if it actually works against coronavirus. The drug, it was initially developed by U.S. company Gilead Sciences for Ebola, but it was never used, then they just shelved it. It's a drug given to hospitalized patients via IV over several days. Well, for most of us, it's as simple as turning on your faucet. Clean, running water, something we count on and sometimes take for granted. And when you fill up that next glass or take a shower this evening, think about how that's not everyone's story. It's World Water Day, and it's a chance for us. As we know, borders all over the world closing as an effort to contain the spread of coronavirus. But the hunt for a vaccine is international, with hundreds of scientists right now collaborating to find an effective treatment. And there are currently no vaccines or treatments for the highly contagious COVID-19 respiratory illness. So patients, well, they can only receive supportive care for the moment. In Denmark, though, the Danish National Hospital is heading European efforts to test the experimental antiviral drug remdesivir to see if it works against coronavirus. Now, that drug was initially developed by the U.S. company Gilead Science for Ebola, but it was actually never used and then it was shelved. It's a drug given to hospitalized patients via IV over several days. All right, for most of us, it's simple as turning on your faucet. Clean, running water is something we count on, but sometimes we take it for granted. Now, when you fill up that glass or take a shower tonight, I want you to think about how that's not everyone's story. It's World Water Day, and it's a chance to focus on one of the most important resources in our day-to-day lives. Billions of folks on Earth do not have access to safe, clean drinking water. And while getting that resource to those in need is a challenge, everyone can do their part to conserve. So don't leave that water running while you're brushing your teeth. We've heard it 1,000 times. Make sure your kids know that too. Also, take shorter showers if you can as a way to cut down on your usage. And you can learn more about saving water at their website. It's worldwaterday.org. All right, with hospitals in New York being overwhelmed by the high number of cases of coronavirus, find out what the governor and FEMA are doing there to help.